Hi, my name is Nicole Terrio, and I'm a diabetes educator over at Northern Maine Medical Center. And today I'm going to take a little time to talk about how to treat a low blood sugar. If you should happen to have a low blood sugar or have symptoms of a low blood sugar, one of the first steps that you need to do is to actually test your blood sugar to see what number you are getting. So once you have done that, if your number is below 70, that is the point in time where we recommend our patients do treat their low blood sugar. Oftentimes people will want to go for something like a candy bar or donut or things like that in order to treat a low blood sugar. However, that is not the best choice due to the high fat content in those types of foods, and it will take your body a little longer to digest and actually bring up your blood sugar. One of the things that we recommend that our patients do is to have a simple carbohydrate that will bring up your blood sugar relatively quickly. One of the best choices is 4 ounces of juice. That's something that most people will have handy in their house and they're able to get to quickly. If you should happen to be away from home, it's a good idea to keep something like glucose tablets with you, whether it be in a pocketbook, in your car, in your pocket. So this way, if you should happen to have a low blood sugar, again, I would say to check if you're having symptoms, check your blood sugar, see what number you're getting. If you're below 70 and you're using glucose tablets and you have the round glucose tablets, then you'll actually want to take 4 of these tablets. Once you've taken something like this, then what you need to do is wait 15 minutes and recheck your blood sugar. You want to make sure that with whether you've taken the juice or the glucose tablets or something else, whether it be a full glass of low-fat milk, something that'll raise your sugar quickly, you want to make sure within 15 minutes that it has done its job. So you're going to, within 15 minutes of taking this, recheck your blood sugar, see where you're at. If your blood sugar has gone up to, let's say, around 100 or so, and this has worked for you, and you're starting to feel a little better, then at that point, that's when we recommend that patients will have something with a carbohydrate with a protein. So then it will actually help hold you and prevent your blood sugar from dipping down again. You can have something like cheese and crackers, peanut butter and crackers. You can have half of a sandwich, or if you happen to be close to your meal, that may be your time to sit down and have your meal. But one of the biggest things to remember is that once you're having symptoms, you need to check, because sometimes the symptoms you may be feeling are not always going to be a low. You may be surprised. Sometimes you may feel like it's a low blood sugar that you're having. Test your blood sugar and you may find that you're actually high. If that's the case, if your blood sugar were to be above 180, then at that point what we recommend for our patients to do is to make sure that you're drinking enough water. So that might be a good time to have a nice glass of water, and it may also be a good time for you to go for a walk or do some activity to see if that'll help you bring down your blood sugar. After you've done something like that, whether it be drink a large glass of water, have some form of activity, within 30 minutes or so, again, I would recommend that you do check your blood sugar to make sure that you are starting to go down. And if that is working for you, then great. If not, and your blood sugar should continue to climb, then you would need to contact your healthcare provider or diabetes educator so they could further assist you. Same with having a low blood sugar. If using these methods, whether it be juice or the glucose tablets, to correct the low blood sugar are not working, then you need to contact your healthcare provider or go to the emergency room or contact your diabetes educator immediately in order to get further assistance with that.